You know, in medicine, some of the most serious injuries are the ones you can't see on an x-ray. They can't be stitched up in an OR. They are the hidden wounds of the mind. Today, we're going to dive into that journey, from a physical trauma all the way to post-traumatic stress disorder, and we'll be using Dr. Atef Ahmed's incredible guide as our map. So let's start with the one core idea that really sets the stage for everything we're about to discuss. This right here, this quote from the book's preface, is our starting point. It just perfectly captures that hidden journey, that space between a healed body and a mind that's still struggling, a space that is so often overlooked. So that brings us to a really big question. Why? Why do these mental injuries so often get missed? In this first part, we're going to explore what exactly makes this wound so, well, invisible. And if you look at this, the contrast is just so stark. Think about it. In an emergency room, all the focus is on what we can see, right? The broken bones, the bleeding. We fix those things fast. But while the body is being put back together, these psychological wounds, the invisible ones, often go completely unaddressed. They leave scars on the mind that can be just as debilitating, sometimes even more so. What the guide makes really clear is that trauma isn't about the event itself. It's about the experience of the event. It's that feeling of being completely overwhelmed, that intense fear or helplessness or horror that leaves the mind just scrambling to figure out what just happened. And this powerful line from a patient in Dr. Ahmed's guide, it just hits you, doesn't it? It perfectly captures that disconnect. It shows how we can be so good at fixing the body, but completely miss the person inside who is still reeling from it all. Okay, so how does that even happen? How does a physical event, an accident, an injury, lead to these profound changes in the mind? In this next section, we're going to trace that exact path, from the moment of injury to the shifts that can happen deep, deep inside the brain. So think of your brain's fight or flight response like a home security system. When there's a real threat, that alarm is supposed to go off. It's a good thing. But with PTSD, what happens is that the trauma basically breaks the off switch. The alarm gets stuck in the on position and keeps blaring long after the danger is gone, making the entire world feel like it's a constantly dangerous place. Now here's something that can be really confusing for people, what the guide calls the sneak-up effect. Right after the event, a person might seem totally fine. They might even feel strong or just kind of numb. But then, as you can see on this timeline, weeks or even months later, when life starts to get back to normal, that's when the symptoms can suddenly burst onto the scene. And this quote, wow, clinicians hear versions of this constantly. It really puts a human face on that delayed onset. See, the mind was in pure survival mode. It was only when it finally felt safe enough to let its guard down that the real processing and the real struggle could begin. So if the wounds are invisible and they can show up late to the party, how on earth do we recognize them? This next part is all about making the invisible visible. It's about trying to understand what PTSD actually feels like from the inside. Generally, the symptoms of PTSD are grouped into these four main categories. You could almost think of them as the brain's confused attempts to protect itself after being totally overwhelmed. First, you have intrusion, where the past just crashes into the present. Then there's avoidance, which is trying to run from it all. Then negative thoughts and mood, which kind of casts a shadow over everything. And finally, hyperarousal, that feeling of being on red alert 24/7. Let's break down what each of these really feels like. Intrusion isn't just having a bad memory. It's so much more intense. It's like being yanked back into the worst moment of your life without your consent. A certain sound, a specific smell, and bam, you're not in the present anymore. You're right back there, reliving the horror. On the surface, avoidance makes perfect sense, right? If something reminds you of the trauma, just stay away from it. But with PTSD, this goes into overdrive. People might stop driving, or avoid going to the grocery store, or even cut off friends. And while it feels safer for a moment, the end result is that your entire world just gets smaller and smaller and smaller. This one is so much deeper than just feeling sad. It's this heavy, persistent blanket of guilt and shame. It's like the color has been drained out of the world. Things that used to bring you joy feel empty, and you often feel totally detached from the people you love, carrying this mistaken belief that you are somehow broken or that it was all your fault. And this brings us to that last cluster, hyperarousal. Living on edge is the perfect way to put it. It's that feeling of being constantly on guard, waiting for the other shoe to drop. Remember that alarm system that's stuck on? This is the result. You're jumpy, irritable, you can't sleep, you can't relax. It is absolutely physically and mentally exhausting. Okay, so understanding these symptoms is so important. But it naturally leads us to the biggest question of all. Is there hope? Can things get better? Let's turn to our final section, the path to recovery. And the answer is a huge, resounding yes. If you take away only one thing today, let it be this. The single most important message from Dr. Ahmed's guide is that PTSD is treatable. Just knowing that, just hearing that, can be a powerful antidote to the helplessness that trauma creates. And recovery isn't some vague wish, it's a structured path. As this roadmap shows, it all starts with step 1, creating a sense of safety and just understanding what's going on in your own brain. Then, from that solid foundation, you can move to step 2, which is carefully processing the trauma with a trained professional. And all of this is held up by step 3, ongoing support, medication if it helps, and leaning on the people who care about you. And what's really great is that there isn't just one way to heal. There are multiple evidence-based therapies that work. You've got things like CBT to help change thought patterns, prolonged exposure to gently face fears, EMDR to help the brain reprocess things. The most important thing to know is that treatment can and should be tailored to you. I want you to really let this sink in because it's such a crucial shift in perspective. The goal of recovery isn't to erase the memory, to pretend the trauma never happened. That's impossible. The goal is to learn how to live with it, to integrate it into your story so that it no longer dominates your life. It's about taking back control. And so we end right back where we started with this powerful question that the guide leaves us with. After the wounds have closed and the bones have mended, how can we, as doctors, as friends, as family, learn to look beyond the healed body and truly see the mind that is still on its own quiet journey toward healing?